Hello, I am Janelle. I'm here to perform a head, neck, and skin assessment on my patient. I'm going to scan the room to show that there are no notes and no cheat sheets. I have checked the patient charts. I have closed the door to provide for patient privacy. In a hospital, that may be closing a curtain or closing a door as well. I performed my hand hygiene, and I'm now going to verify my patient by his wristband. Your wrist, please. Can you please repeat your full name?
Stephen Connick,
And your date of birth?
12/13/1995.
And do you know where you are?
Lapeer.
My patient's LOC is +3. He is alert and oriented. I'm going to start my assessment by assessing my patient's skin. His skin color seems to be true to ethnicity. There's no signs of jaundice, cyanosis, or flushing. I'm now going to palpate my patient's head to feel for any skin lesions or masses, and in doing so, I'm also going to feel my patient's hair. Is there any tenderness?
No.
Okay. No tenderness is a good finding. There was no masses or lesions found. His hair was evenly distributed. There was no thinning. It was soft, thick and full, evenly distributed, no baldness. His eyebrows and eyelashes are both symmetrical with evenly distributed hair, which is a normal finding. I am now going to test the turgor of my patient's skin by pinching the skin over his supraclavicular area. And in doing this, we're going to be looking for signs of tenting, which is where when you pinch the skin, it's going to stay up a little bit. There was no sign of tenting, which indicates my patient is not dehydrated, which is a good finding. Do you have any family history of skin diseases?
No.
Have you ever had a skin disease?
No.
Have you noticed any dryness, oily, change in texture of skin?
No.
Patient's skin is warm and tapped. There's no visible lesions. I did not feel anything abnormal, which is a good finding. Do you perform self-examinations on yourself?
No.
Okay. Do you have any moles?
No.
Okay. It is important to regularly perform a self-examination on yourself. By doing so, you can look in a mirror, or you may ask a family member, a spouse, go to your doctor. If you notice any changes in moles, do you know what the ABCDE rule is?
Sort of.
Sort of, okay. So A is going to stand for asymmetry. Is the mole symmetrical on both sides? B is going to be the border. Is the border smooth and rounded, or is it jagged? Jagged would be an abnormal finding. C is going to be the color. Is the color, has it changed? Is it gray, black, or white, which would be abnormal, or is it brown, which may be normal? D is going to be diameter. Has it gotten larger? Has the diameter changed shape? And then E is going to be elevation. If you have noticed a mole becomes elevated off the skin, that would be an abnormal finding. Okay. I'm now going to palpate my patient's frontal sinuses. Any tenderness?
No.
And I'm now going to palpate my patient's maxillary sinuses. Any tenderness?
No.
Okay. There's no inflammation, no redness, and no heat coming from his sinuses, which is a normal finding. I am now going to palpate my patient's 10 sets of facial lymph nodes and neck lymph nodes. First, I'm going to start with the preauricular. Then I'm going to go to the postauricular. Then I'm going to go to the occipital. Then the submental. Then the submandibular, tonsillar. Did you feel any tenderness?
No.
That is a normal finding. I'm now going to go to the superficial cervical. Posterior cervical on both sides. Can you tilt your head to the right for me? I'm going to move the sternomastoid muscle and feel for the deep cervical. And then I'm going to, you put your shoulder forward and up for me. And I'm going to feel for the supraclavicular. And then I'm going to touch it to the other side. And on this side, I'm also going to feel for the deep cervical. And then the supraclavicular. I did not really feel any lymph nodes, which is a normal finding. If you were to feel them, they should be soft and you should be able to move them around, so they should be mobile. If you found any lymph nodes that may be hard or immobile, that would be abnormal. It may indicate inflammation or an infection, which would need to be further assessed. I am now going to inspect my patient's eyes. Have you noticed any changes in eyesight?
No.
No. Any family history of blindness?
No.
Do you wear any contacts or glasses?
No.
And do you regularly see your eye doctor?
No.
When was your last vision test?
15 years ago.
Okay. It is important to regularly see your eye doctor and get those vision tests, only to promote your health. And if you notice any changes in eyesight, you should go see your eye doctor. I'm now going to inspect my patient's perla of his eyes. Just look straight ahead for me. Both of his pupillary reflexes were equal on both sides, which is a normal finding. His pupils appear to be round. The irises are also round, with color evenly distributed throughout. Can you look up for me? The sclera seems to be normal, and the conjunctiva seems to be white and normal, which is a good finding. I am going to ask you to follow my pen with your eyes. Okay, that shows to me that cranial nerves 3, 4, and 6 are intact. Also, by testing cranial nerve number 2, you could use a Snellen chart, which is where you stand back away from the wall about 10 feet and look at the chart and read the letters as far down as you can. The vision of 20/20 is considered perfect vision. But in this case, my patient has not showed any signs of abnormal eye findings and no changes in eyesight, so cranial nerve number 2 is intact. I'm now going to move down to his nose. Have you noticed any changes in smell?
No.
Okay, I'm now going to inspect my patient's nose. It seems to be midline to his other facial features. I'm now going to look inside his nasal cavity. Look up for me. Both the middle and inferior turbulence are visible. There's no foreign objects. Everything looks normal up in there. If you shine your pen light into the right side, you should see faint glowing on the left side, but if you were to see a bright light shining through, that may indicate a perforated septum, which would be an abnormal finding. To test cranial nerve number 1, you would ask your patient to identify a familiar smell, but in this case, he has not indicated any signs of an abnormal findings in his nose and no changes in smell, so we're going to say cranial nerve number 1 is intact. Okay. I'm now going to test cranial nerve number 5. Can you please open and close your mouth for me? Okay. Cranial nerve number 5 is intact. There was no grinding or popping in the jaw, which is a normal finding. I'm now going to go to his oral cavity. Okay, can you pull on your lip and okay. Okay. Everything looks good in there. His gums are pink. Everything is moist. His lips are also moist. Can you stick your open your mouth and say ah?
Ah.
Okay. So his uvula and soft palate both rose midline, showing that cranial nerve number 9 and 10 are intact. Can you please repeat the words light, tight, dynamite?
Light, tight, dynamite.
Okay, by repeating those words, he proved to me that cranial nerve number 12 is intact. I'm now going to move to his ears. I do not see any foreign objects or any signs of drainage on this side. I'm going to go to the other side. Okay, there's no drainage or foreign objects in that ear either. The pinna on both sides seems to be firm, which is a normal finding. And have you noticed any changes in your hearing?
No.
No. Okay, so that is also a good finding. Can you stick out your tongue for me? Okay, he was able to stick out his tongue straight, which shows that cranial nerve number 8 is intact. I'm now going to perform the whisper test. Just tell me which side you hear a noise coming from.
Right. Left.
Okay. And can you please stand up for me and close your eyes? Okay, you can open it down. Okay, cranial nerve number 8 is intact. Okay, can you lay down for me? Can you take your right heel and rub it up and down your left shin? Okay, and now do the same with your left heel. Okay. You may sit up. My patient's coordination seems to be intact. Can you rotate your neck around for me? Was there any stiffness or pain?
No.
Okay, so that's a normal finding. And then can you lift your arms out from your body and pull them back in? Okay, so both abduct and adduction were both normal. So his range of movement seems to be good. Okay, so we tested cranial nerve number 1, which would be the familiar smell. Cranial nerve number 2 would be with the Snellen chart, which we do not have here with us. Cranial nerves 3, 4, and 6 are the eye movements, which all those cranial nerves were intact. Cranial nerve number 5 was his TMJ, and there was no popping, which was a normal finding. Cranial nerve number 7, can you please puff out your cheeks for me? And raise your eyebrows. Okay, very good. Cranial nerve number 7 is intact. Cranial nerve number 8, we performed the whisper test and his balance or Rombert test. Both of those show that cranial nerve number 8 is intact. Cranial nerves number 9 and 10 was when he opened his mouth and said, ah. Both the soft palate and the uvula rose midline, which was a normal finding. So cranial nerves number 9 and 10 were intact. Can you shrug your shoulders for me? Okay, and turn your head. And the other way. Cranial nerve number 11 is intact. And then can you please repeat the words light, tight, dynamite?
Light, tight, dynamite.
Cranial nerve number 12 is intact. Throughout this entire assessment, my patient has remained with an appropriate posture. His head is erect and stable. All of his movements have been smooth and controlled. His facial expressions has remained appropriate for this situation. He has not experienced any muscle spasms or uncontrolled muscle movements, which is good. There were no abnormal findings. All of his cranial nerves are intact. There was no inflamed lymph nodes. And his attitude this entire time and behavior has been normal. So that would complete today's assessment for the head, neck, and skin.